Well, welcome back, everybody, and welcome to Mind Your Mouth podcast. I am your host, Melissa Mugno, and as always, I am super excited to be bringing you guys another guest. This is not just some doctor that I know. This is actually my doctor. So it's a very personal story, and you guys know on Mind Your Mouth, I always love to keep it real, keep it vulnerable, and let it all out and talk all things. And so when I was thinking of my next guest, I couldn't think of someone better. Welcome, Ashley, to Mind Your Mouth.
Thank you. I'm so honored to be here.
Well, I am so excited to have you. And yeah, I'm excited for us to just be able to talk all about functional health and functional medicine because a lot of the Mind Your Mouth peeps and the people that are watching probably are a lot of my Airway people, but we've had so much great growth lately. And there's just this amazing connection about everything we do from functional medicine to obviously the mouth. And I just want to talk all about it today. So tell us a
Yes.
little bit about who you are, what you do, and how you got
Yeah,
there.
exactly. I would love to. So I started out in the very traditional model of I went to college. I was like, I'm going to go to PA school and I'm going to change lives. And I
I love that.
learned all the traditional ways to treat people and following an algorithm and giving them drugs. And I'm actually still working for the same doctor. And one of the first, 16 years later. And one of the first few months
Oh,
I was
wow.
there, he was like,
So you've been with Dr. Bond for 16 years.
16 years. And he says, you should go to this anti-aging conference. So I have to credit him in starting this journey for me. And I went to an anti-aging conference through the A4M. And I learned more about thyroid physiology in a 1 hour lecture than I had in 3 years of PA school. Like I had just learned
Wow.
low thyroid, give them Synthroid. And my eyes were opened and I was hooked. And so I continue to go to these conferences all the time because the body wants to work and it wants to do what it's made to do. And so sometimes it's a deficiency or an imbalance,
Well,
or
I'm actually going to
maybe it's
stop you
not a
right there
drug
because we
deficiency.
have
Yeah.
No, we have this little saying that we'll talk amongst the community that, people that get caught up, aesthetics, right? They'll say, well,
Hmm.
I don't care. People will kind of get down on themselves and say, it doesn't matter what it looks like. I just want it to function. And we say function is actually beautiful aesthetics, right? Like if something that's functioning really well is really desirable, like it looks great, it feels great. You're the best version of whatever, if it's your smile, your bite
Yes.
or all that. And so I think that's even like every time I talk to you and we've gone down our journey, I think that's right. People are always like, oh, well, that's, cosmetic. And I'm like, well, no, it's because people are deficient in the functional side, right?
Right. Right. So yeah, it's been a really amazing journey for me to just keep trying to help patients find what's the root cause, or what can we change in your function or your diet or your lifestyle factors. And so it's really amazing. So that's what I do.
Yeah. It's interesting that one of the biggest things we get, you do know much about my world. We've talked about it. You've kind of been drawn into the myo mouth world a little bit.
Yeah.
And I would thought maybe we could even just start and I would open up. Most of my listeners know a lot about my own journey, but the fact that to have function, right, to be functional, it takes
Hmm.
so much more, right? So breathing, all of these things, but naturally there's this little bit of, I don't know, I want to say pushback, right? Like there's a lot of doctors that don't want to go to the root cause. And I'm not here to bash anyone or everything, but the facts are the facts.
No, same.
And
And
I,
honestly,
yeah,
a lot of it I think is the model, right? So it's very hard to squeeze patients into a 7 to 10 minute window and see 1 million patients a day. And so we've kind of altered our structure at our clinic because I need to get to know my patients. I need to know if they sleep, if they poop, how they're breathing, what they eat, what their personal stressors are. And so, yeah, some of it I think is just shifting the paradigm of how we look at patients rather than, oh, you have a cough, here's a pill, you know?
yeah. Well,
So,
one of the areas when I came into, I was not that I was running probably 100 miles an hour. I'm maybe 85 miles an hour, 85 miles an hour. And I think that go, 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 right? Nonstop, that adrenal fight or flight response is something a lot of
Yes.
us see in behavior. And I think I would say women, right, ultimately, I feel like are a higher area of this. So
Oh, yeah.
walk me through a little bit. What are these common things? And you can use me as a perfect example. Like, please feel free. We can use my case as much as possible. Whether I happen to come across high, like it's not like a shock to see, oh, well, Melissa's like kind of high in that fight or flight. But there's people that maybe don't have the mannerisms that I do or don't speak at the cadence in which I do, but
Hmm.
will present similar. Is that correct? Like still high adrenals?
Yeah. Unfortunately, sometimes by the time patients reach me, they've almost burnt out. There's various
Mm.
stages in adrenal dysfunction or dysregulation. We used to call it adrenal fatigue. That's not really what happens, but you'll see this ramped up response. And nobody really complains at the beginning because they've got lots of energy and they're still going until it starts to cause an increase in their blood sugar and cause an increase in weight gain, and their anxiety goes through the roof and their sleep goes out the window. And so, yeah, it's funny because I came to airway and breathing and the importance of this kind of backwards. So I
Mm.
would see patients day after day with these low hormones, and I'm looking at them and I'm going, how are you late 30s, early 40s, and you have low hormone levels? What is happening? And so in my functional med mind, I start going, okay, what would I call a pediatrician for if my kids weren't doing? If they weren't eating, if they weren't sleeping, if they weren't pooping, if they weren't breathing properly, they weren't, you go through the
Oh, wait,
basics.
that is like, talk about basics.
Yeah. And
I
it's
mean, and a lot of
fundamental.
people, right? Because people will say this is complicated, it's complex, and it is, but it's also really simple.
Yes. So you have to almost boil it down. And I think people kind of look at me and go, oh, maybe I can actually change this because it can be very overwhelming. And as you know, I talk a lot. And so I will bombard my patients with lots of information and they go, wait, what are my actionable items that I can do? And so if I start at those basics with patients, which, I started doing Epworth screens and stop bangs, and I started finding out that a lot of these men will show it earlier because their testosterone will just drop. Women, the numbers are just a little bit lower, so it kind of sneaks under the radar for a while unless you're looking for it.
So if we're looking at a woman listening to us right now is
Hmm.
like, "Ooh, she said burnout."
Yeah.
Burnout is like, okay, what are like some of the top signs of that you're heading down that road, that there's something going on?
Oh, well, most of us kind of know we're doing it to ourselves anyway because we've made sure all the kids' lunches are made and our husband's
Mhm.
coffee's ready to go, but we forget that we need to go eat protein, you know? And so,
Protein is not easy.
no, but you'll find that, the sleep patterns start to get interrupted. The attitude and mood just starts to be like, I don't even care anymore. They're just kind of, you don't see these responses. Yeah. I mean,
So
most of
you're
the
not
time
you're
women know.
yeah, you're not you know that you're feeling your best self. You're not
Right. Energy
that you're
levels are
just
super low. You're starting to notice that, things that you used to do and eat and the amount of exercise you used to get would do the job. And now you're stacking weight in places you didn't before. And it's
you
becoming more
just feel like
difficult.
your body's not functioning the way it used to.
Right.
Everything feels like it's slightly harder than it should be, right? In a
Yes.
sense, like everything just
It's
feels
like just
harder and
this
harder.
uphill trudge. And it's
Mhm.
funny, I often will tell my patients as a child of the 80s, I loved The Price is Right. And if you recall, the little
Yeah,
tiny yodeler that would go to the top of the mountain and then he'd fall off,
love
I
him.
often will use that as a visual for my patients. And I'll say, look, you're headed up the mountain and it's only a matter of time before you fall off. Because you'll see the DHEA and cortisol levels climb as women are trying to just keep going. And this gets really exaggerated in perimenopause because now you don't have the estrogen and progesterone and testosterone to help you balance out. And they'll swing wildly.
So from your side of things,
Hmm.
to actually regulate, like to be able to regulate hormonally, metabolically, mentally, all of those things, it requires kind of really checking in. Would you say, like, how would you start with something like that?
Yeah,
Like,
I
how do
mean,
you start to like look in that?
so one thing that I'll often ask women to do is just take a look. What are your non-negotiables that you need to do? And then what are those few extra things that you keep going? Yeah, I'll bring snacks for the class. Sure, I can. There's a few things that maybe you could scale back on so that that energy demand goes down a little bit. And then I have them again. Focus on the basics. Are you getting 7 to 8 hours of sleep? And if the answer is no, full stop. And in functional medicine, I try desperately not to put patients on medications if I don't have to. But I tell women there are two things I will drug you to do: sleep and poop. And if they're not doing those, we have to really go back to what can we do nutritionally? What can we do behaviorally? Because I can't fix you if you don't do those things.
Which is okay. Well, that, I mean, now you just, all of my myofunctional therapists and all my dental people went, okay, all right, I'm here. I'm listening to you, Ashley. I like what
Yeah.
you just said, because
Yeah.
sleep is complex. Digestion is complex at times, right? Our gut health
Yes.
is a really big deal. And I think, so let's chat about it. Most people that have watched have seen my story. So I spent years and years about, right. We went through my journey of, I was on Lexapro, Adderall, drinking a glass of wine at night to try to curb that. A
Sure.
lot of it, I always had it, right? It was always lingering in my 20s. After I had Natalie, that's when the Lexapro thing started, because they said after I delivered her, a really crazy C-section, and then they gave me a
Hmm.
ton of painkillers, and then I was coming off of them. I felt, you know, obviously I was on nothing during my pregnancy except
Right.
vitamins and all those things. I didn't do anything then, but the the pregnancy, there was a lot of fear, by the way, to even deliver, and then it was like emergency. It felt very, to be honest, it felt very dramatic in her
Sure.
delivery. And then there was fear, and now I know, just motherhood coming into that, not 100% being, none of us are prepared, but I felt such like a foreigner in my body after birth.
Yes.
I felt lonely, like more lonely than like you had this beautiful baby, but I felt really empty, because I think obviously I went back. I mean, you can give us a little bit of the science on it, but I just felt depleted in ways.
Right.
And then they gave me drugs again, and I hadn't had drugs, right? So all this morphine and all these pills because it was painful. And they sent me home with painkillers because of a C-section, and
Right.
I was taking them. And I remember my mother-in-law and my sister-in-law in the living room or in the kitchen trying to help me. And I could hear the cabinets like closing and opening. And you would have thought, I thought somebody was playing a full drum set in my head. And I screamed and then cried. And I just said I
Yeah.
wanted everybody to go away. But yet I had this beautiful baby. I go into the OBGYN, 2.5 minutes, checks, boom, boom, up, you're having depression. And the next thing I know, I'm on 10 milligrams of Lexapro. It went that quick. I don't remember there being much conversation about it. And that Lexapro became a part of me for the next,
Yeah.
until I had Jackson, which was until 8 years later. That was the first time and then they told me to stay on it when I got pregnant again, because they don't want to take me off. And I was depressed on and off. I always felt depressed still. And I feel like that cycle, and I know listeners can relate to this. Then I was exhausted and tired, and they said, well, you have ADD, and they put me on Adderall. And the Adderall just kept going up. And I'm functioning. I'm in a sleeping world. I already struggled with airway deficient issues, the grinding, the clenching, all of
Yep.
that stuff was happening, headaches, pain, and I'm just blowing up like a balloon. The weight up and down, always been part of it. And here I felt like a total kind of scam artist because of teaching other people to breathe better and do all those things, but internally was just dying and didn't really understand what to do with that. And we actually, most of us in the dental airway space and myofunctional, we struggle with scope because a lot of patients are me, right? Most patients come
Yeah.
in, you and I have shared multiple patients now, like they're me. And of course, I'm not a mental health specialist. I mean, I do it, from a mindset
Same.
perspective,
Right.
right? we all have mindset work, but this is really foreign to a lot of people. So if you can kind of be open and kind of explain maybe the science of what was going on with me, what was happening, where was my mind, like what was my body doing to maybe help us be able to communicate this better or be able to help connect dots and get patients. That's why I wanted you here. I wanted everyone to understand they should seek out people like you and what you and Dr. Bond are
Sure.
doing.
Yeah, absolutely. And, it's a postpartum is a super tricky time for women. And I mean, you go from hormone levels up here to drastically reduced, remove that placenta, sweet baby comes out, and now your hormone levels just plummet. Not to mention, you
Mm,
just piled on anesthesia and a surgery, which are traumatic in their own right. Your immune system has now switched from suppressing so you don't attack your baby to, hey, let's go back and fight the outside world. And you now are responsible for a beautiful human life, but you didn't get a book to tell you what to do about it. So the whole thing, on top of that, let's be honest, you don't feel great. So are you turning to nutritious rainbow colored foods and protein sources? No, you're
mm,
getting an ice cream shake because you think it's going to make you feel better. And
mm.
so most of those neurotransmitters are made in the gut. So if we're not feeding the gut properly, we're not producing the chemicals that can impact our brain. And then the cortisol goes so high post surgery. And that whole 3-month period following delivery is chaotic. And I get it. Medicines have a place sometimes. And that OBGYN probably thought she was helping you to just get out of a hole,
Of
or
course.
he, but it sometimes I feel like, well, what if we maybe put you on some saffron? Or what if we worked on the oxytocin to make you feel connected with your baby, make you feel a little more motivated, help you with that milk letdown? Do all of those things make that very tumultuous road slightly less bumpy? So,
So that, I mean, and that it's taking that little bit of extra time of looking at where I was depleting instead,
mhm,
right? Am I right? Like, look, like
right.
again, that root cause, figuring out, wait a minute, why is this happening to you
And
instead
some
of
of
just
it is,
giving something?
yeah. And honestly, it goes so far when you just explain that to patients too. Like, hey, this is what's going on. It's going to be a little terrible. Let's work through it. Let's
Mm.
do these things in the meantime. Can we put you on different vitamins to support you? And there's a lot of
To
approaches.
build, yeah, to build us back up, right? To start
Right.
supplementing and filling all those holes.
Right.
Which one thing what I wanted to go down, and I think you and I have had a lot of great conversations about this, is sleep and stress hormones, right? Just in
Hmm.
general, because it feels for a lot of people, like you just said, hey, are you sleeping? Are you pooping? Right? Like, are those two
Right.
things happening? Most people are like, sounds so simple, so difficult.
So complicated. Yes,
Like we take them for granted.
we do.
And I don't think most people want to say openly to people like, I don't and what people will say, "Oh, it's okay. I'm really stressed in my life. I got this
Yeah.
going on. I got that going on." It's just going to be like this for a period of time, and the next thing they know, it's been like that for 8 years.
Yeah.
Yeah,
Yes, exactly.
something like that. I don't know. That's what
Exactly.
I feel.
Oh, all the time. All the time.
So,
But yeah,
yeah,
go ahead.
walk us through that a little bit. Like, so when we think of like, you've helped me understand so much about my body of like why I couldn't achieve the where I was going on things,
Hmm.
and that, and yes, my understanding of sleep, but it really helped me like bring this together of just like, hey, you can do all the myofunctional therapy and expansions you want, and you can do all the jaw surgery, you can do all that. You need it. No one's denying that. But if you don't get this other piece, if you don't get the hormones and the stress down, the cortisol, the estrogen, the progesterone, all of that stuff, we're
Yes,
really helpless, right? And they all kind of dance together.
very much so. I mean, it is a very messy blend of the interaction all of these hormones have on each other. But yeah, so one of the biggest things that I start to see happen, and this gets really accelerated during perimenopause, but
Mhm.
when patients aren't sleeping and they're stressed either consciously or subconsciously, right? Do they have a high viral load? Do they have nutritional depletions? And then the things that you can name, right? Like, oh, money and my house and all the things I have to do. All of those contribute to raising cortisol. And cortisol, while it is very important, can really start to set off this cascade of other hormone dysregulation. So it'll raise insulin, it'll raise your blood sugar. And what we see in perimenopause is that as the estradiol and the progesterone start to decline, progesterone is also a respiratory stimulant. So when you're already disorderly breathing, and now you don't have those hormones that used to help you out a little bit, it just fans the flame. And so I'll see this really big imbalance of high cortisol, low estradiol, low testosterone, low progesterone, high insulin, high glucose. And patients just, they can't get it together. So until I work on strategies to help augment or even replace if they're there, and strategies to lower this end of the graph, I can't get anyone to feel better. So, kind of like I was talking about earlier, men with low testosterone, until I correct their apneas or their hypopneas or their, this is your area of expertise. But once we work on that, I can give them all the testosterone in the world, but they still won't feel any better. Women the same way. They still won't be able to lose the weight. They still won't feel like they're better, but they're not quite where they were.
Which is an interesting thing. We both, so, people were talking, we live in Lafayette, Louisiana, and it is when I first met you personally, and then also you practice very much. Like when I walk into your guys' practice and I walk into your space, I do feel like I'm back in New York, I'm in Dallas, I'm in Vegas. It doesn't feel like, from on the bigger stage. Lafayette is a smaller city, but it really does feel like you guys are doing higher, bigger city medicine, which is what I think communities need. And I will say the medical community here in Lafayette is strong. It's thriving. We have some of the most really, really amazing entrepreneurial people, really, really smart people, but people really love their families here. Like that's my thing about Lafayette that I love so much. The family values are untouchable. I'm so blessed that my kids are being raised here. It's just something I feel like I step back in time and it's so beautiful. But what that brings is the one thing that I think Louisiana's got to know is sports. We love our sports here. We love our sports. We love being in shape. They love football. We love all of it. I mean, seeing everybody's kids are in 9 sports. And so athletics, we think of testosterone. I think of testosterone, athletics. I want my kid to have, all of us to have that edge. And I think this correlation, and I love that you're topping on it, is that you're not going to be able to perform, peak, be able to be your best version. Doesn't mean you're going to be a professional athlete, but be able to have those wins and whatever it may be if you're not getting sleep and you're not getting testosterone. And I don't think there's a lot of parents, Ashley, that connect that so much, right? Like the way their bodies are growing, growth hormones, all that stuff. I love to just get your, just your take on it. You got 3 kids. I love your children. Love your husband. She has an amazing family. So just love to talk a little bit about that. Like if you had some moms sitting, listening around about, hold on, you're talking sport and growth and, all that stuff.
Right. Well, I mean, lucky for us, we have you. And so we saw this firsthand in our own family. So my oldest son, pretty severe tongue tie, and we have a lovely little MTHFR SNP everywhere back in our family tree. And so, not super surprised that that occurred. But what was insanely surprising go ahead.
I'm actually going to stop you. Can you explain the correlation between the two? Like when we see with tethered oral tissues and why it matters?
Yeah, I have looked into a lot of potential reasons of why that matters. And what, clearly I'm no geneticist, but in listening to lots of really brilliant people speak at anti-aging conferences for decades, is you can have a set of genetics that maybe sets the stage. What you're doing behaviorally and in your lifestyle can kind of turn those genes on and off. Well, specifically, a lot of us have some methylation disruptions. And methylation is, I'm trying to name a system that's not involved in. It's impossible. But methylation is literally the act of kind of turning on and off different genes. So it's important in hormone regulation. So in perimenopause, again, I'm looking at that because women won't be able to clear their estrogen well. But methylation ties also into folate metabolism, which this is where we can see that maybe women, when they're pregnant with MTHFR issues who aren't methylating well, they can have some issues where cell signaling isn't quite right, or there's an issue with the ability to develop that neural tube when the baby is forming. And so we happen to see a correlation with tongue ties and methylation issues or disruption.
Perfect. Because you had recommended some chest creams for Jackson, and I know for your boy and for your children, and it's been helpful. I've been recommending it. We've been telling people about it, and their doctors are using it. So it's a pretty simple thing that you can do, right? There's actually topical creams that you can use. Because it's B, it's all about B complex, right? Is it the B's?
Correct. Or it's specifically methylfolate. So most of the time it's a problem in converting that to the active form, but you need a lot of the cofactors as well, which are other B vitamins, some beta-ine, choline. There's a few other things that are involved, but yes, mostly you'll hear methylfolate and MTHFR. So you kind of need to consider those things.
So now bring us back to your boy. So, right, we saw he had a tongue tie. Yeah.
So we all have some methylation issues, which also will influence anxiety and focus. And couple that with his pretty severe tongue tie, he was having some disorderly breathing at night specifically. We were having a lot of inattentive issues. And when you just brought up sports, it actually was really eye-opening for us because this season, he actually was able to control his emotions so much better that he was able to focus as the quarterback of his little flag football team. And we saw way less meltdowns and way better regulation of his ability to control that nervous system response. So it was very impressive for us.
To see from both sides the connection of just how much the body holds everything, right? Like both of our boy, like especially your oldest and JJ, like just how much they wear their emotions and their aspects of it. And yet they're very similar, both pretty severe tongue ties, that tighter jaw positioning, and just really living in their chest and living, like breathing from their chest, like not dropping to their diaphragm, and then being in their head.
Yeah, big time.
And you and I,
and after we corral him long enough to make him do his exercises, you'll see this like a physical release. His shoulders come down, his little face relaxes. And yes, it's amazing.
It's amazing.
I have a new appreciation for it personally and in my practice.
Yeah, I was just going to say, so practice wise, after seeing, I mean, obviously just going into this next level, I mean, the big thing that we hear a lot in sleep, and sleep apnea, weight will come up a lot, right? They're overweight. That's why their sleep index is the way it is. And I always feel like you want to talk about a really terrible thing to tell somebody, like someone's complaining about their sleep and then tell them it's because they're fat. Because I'm being a little cheeky, but no duh. Like
you're like, but it's
it's
bidirectional, right? So they don't sleep and the cortisol and the insulin and the glucose are dysregulated, and then they put on more weight, and then the weight is inflammatory and also stimulates the cortisol. So it's just this terrible cycle people get stuck in.
And then the weight gets really trapped, especially around female wise,
right around the spare tire. It's
right around that spare tire. And one thing, that when I connect the mental clarity of it, and I want to just bring it kind of these three circles, was as I came off all those pills and I started to want to decrease the inflammation in my body, right? Because I just felt so inflamed everywhere.
You were.
But I realized mentally, I absolutely.
Try not to divulge too much of
No,
your.
I no, you can, please. This the whole point of the listen, I'm gonna run my mouth anyway, so I might as
I
well
love
do
it.
it so people can benefit.
Yeah.
And if they wanna listen, they can. If they don't, they could just turn it off. But that chronic inflammation, which really was my own thought process too, and the
Sure.
fact that my mind and, where your mind goes, your energy flows, but that mindset was really an issue. So we've done a lot.
Yes.
We've talked about it. And I want to say what was really nice was being able to walk into your office and be very open about what I chose to do for my mental health. Meaning that,
Sure.
like I tell, it's not easy to always walk in and be like, I took myself off of all of my own pills. I
Yep.
went down to the jungle or and I didn't go to the jungle. I went to Costa Rica, which we all know is a very nice place, medically supervised, but I chose to use an alternative, psychedelic medicine to help me get my mind right because I couldn't get my body right until I did that. And it's not for everybody. And I'm not saying it, but when you really are in those patterns of that would I have really been able to change my physical health if I hadn't gotten my mind right?
I doubt it. And I have to say, as watching your experience pre and post and seeing you objectively, it was a wall breaker for you and it was game changing. And I feel like your ability to then self reflect went up exponentially. And then we could really work on getting your root causes improved and moving you forward in your journey.
Because a lot of people, and I think most people can relate to this. Food is its own drug,
Hmm.
right? It's its
Oh, yeah.
own, and it's fabulous. I mean, food has got so many beautiful memories to it. Like it brings joy, the taste. And for us in the airway space, chewing is a very important tool. It's a muscular a builder, and it's really crucial. And a lot of us don't chew the way we're supposed to because of our food quality, and then goes back to nutrients.
Yes.
But there's this when I'm feeling sad or I'm feeling lonely, I'm looking for that quick hit. Some people shopping addiction, whatever it is, that
Yeah.
those impulse controls. And we spent 2 big sessions just talking about this, that when I went low, and now what I've realized through currently my new area of things is realizing I didn't have any discipline growing up. I just didn't. My mom, no offense, she wasn't strict. And when I saw discipline, I thought of discipline being pain or as it being punishment. But
Yeah.
really, there's joy in having boundaries and having some discipline. Great things are accomplished from it. But having boundaries or some discipline around food, when you need to eat, when you don't need to eat, instead of just self indulging, was something I really struggled with. And I don't even think I would have been able to self reflect that if I hadn't started peeling back those layers of
Yep.
why was I eating so late at night? What was I pushing down into my gut so I didn't feel what I was feeling?
Right.
And it was contributing all over my body. And I know this is taboo. It's hard for people to sometimes go this deep. Some people might not even think it connects. But
Hmm.
when people look at me now and they go, "Oh my God, you look so great," and I'm like, "Yeah, the physical aspect was one part, but it was all of these little
Right.
layers, right, to get there." And I am sure you have people that come in to the clinic that you see that they have one direction, one focus, and they want you to be able to provide a magical wand to them. And is it
Yes.
possible? Can you do that without this 3 layer? Of course,
It's really
what's your thought
not.
on it?
No, it's really not. And when I'm meeting a new patient, I often will tell them, you live in that body, not me. You need to understand. And I said, but I will always treat you like my family, which sometimes means I have to get in your own way. And so half my job is education and empowerment. So you're able to do these things. I need you to look in the mirror about what's really the reason you're doing. Why do you want to lose the weight? Are you trying to be included? Do you want to feel better? Do you think it's all these fun psychological things I never thought I would be addressing for women, but it's huge.
It's huge because it's this like multi comp it's a
Yes.
three-dimensional problem, right? It's functional, structural, behavioral. You can't
Yes.
do one without the other.
Yes.
So I want to go, and talk about the one thing in the room is people have asked, and I've been very open on it. We did choose to put me on a GPL-1.
We did.
And I let everybody know I spent a year before, right? When I first came to, I was a year in the gym. I was not
Mhm.
drinking. I was
Oh, yeah,
eating
you had
much
put the
as
effort
best I
in.
could. I was struggling. I was definitely still struggling with my discipline around my food,
Mhm.
but I absolutely I was just running, and we made a joke. I wanted to just run on the treadmill everywhere, running from all my problems, running from maybe
It's like,
running
we're
from
gonna need to
Lafayette.
do a
I don't
little
know.
different strategy there.
So,
Yeah.
right. And then lifting weights, but I lost about what I think it was like 14 pounds in the gym, but I still was carrying so much gut, and my memory was in the tubes. Like it was really, it's not great. It's not fabulous, but it's much better than it was. And I tell everybody the GPL-1 for me, and I want you to explain to us
Yeah.
why, how, all the taboo on it, because everyone's got
Sure.
opinions on it. I remember walking into you the first 3-month check, and I said, "Oh my God, I love this. Feel I feel like I remember things that I never
And
remembered,
we were
like the
on a
mental clarity."
microdose.
Yeah, mental
So,
clarity. I also made a joke. I was like, "I'm not shopping as much."
mhm.
And my food relationship was so different. Like I just was like I all of a sudden was asking myself, why are you eating that, Melissa? Why do you need that? So talk us through this. What is it?
Yeah.
Why does it work? Why do some
So
people hate it? What's all of it?
personally, I was anti GLP-1s initially because, again, remember, this new fancy magic bullet drug comes out and everyone gets really skinny. And I didn't really understand the science on it initially. And I'm coming from a functional approach. So I'm going, well, are these people checking their muscle mass? What are they doing? Are they exercising? Are they eating? Are they doing all the other work that is foundational? And then using this really amazing peptide to come in and just level up, right? So my understanding of that had to come full circle. And I've got to credit Dr. Tina Moore here for this. She is amazing. She's a functional medicine doc. And I had the luxury of meeting her forever ago through Dr. Bond. And then most recently, we were having dinner and she's talking about all the benefit that she has seen in microdosing these. And this is still when it was just semaglutide, microdosing these medications in her patients for all sorts of things, autoimmune, neural inflammation. She speaks out about how she helped her own mother with Crohn's. And I'm thinking, what? I thought these were just diabetes drugs and weight loss drugs, right? So after a little bit
Yeah.
of research, these drugs help to do a lot of things. So even we naturally produce what this peptide is, what the big pharmaceutical companies have mimicked in this drug, right? So it will help stimulate more insulin when there's more glucose. And so remember, insulin is the little key that knocks on the cell and opens the cell and lets the glucose in so it can be utilized. So it's going to help the pancreas do that. It's going to reduce production of extra sugar. So we have some kind of stored sugars. It slows that down. It slows the gut transit, which are the main things that we first knew. Well, the more research I started to find, it's that these GLP-1s and GIPs, which is also found in Tirzepatide, which
Hmm.
is Mounjaro or Zepbound, also help. There was a big meta-analysis that came out, reduces CRP and IL-6. Both of those are big inflammatory markers. Also, there was a European study that showed that it would reduce the inflammation and the hormones would kick back up. So once you kind of get that inflammatory chaos under control, both in the brain, which is why we see a lot of self-regulation in those dopamine seeking activities. Patients will say, I don't really want to have that glass of wine when I used to turn to it every night for stress relief. And I'm not buying 55 things on Amazon when I used to do that every night to try and self-regulate. And so it's been really impressive across literally most of my practice to give a little bit of that to patients, and their quality of life, their total inflammation, everything starts to reduce. And then all those other peptides and hormones and nutrition we're using now can have a place because the whole body's not on fire. So they'll have a much bigger impact.
So why the negative about it? Why is there such bad press on it?
So you do have to be mindful of what you're doing with these drugs as well. Because let's say, for example, you start following the protocol of ramping these doses up to a 15 milligram dose. Well, yes, it's going to dramatically increase your glucose utilization, but you may start pulling from places you don't want to, like muscles and bones. And maybe the patients don't have the best diet and the best exercise, and they already have some gut dysbiosis overgrowth, and you go slow that gut transit down even more. Patients potentially can end up with an ileus or a block, which is an emergency. I mean, you must go to the ER. And so I find that just cranking it up without educating the patient about what else they need to be monitoring. And then I personally, as you know, have my patients, because I'm just an overprotective little PA mama, I have my patients come in and weigh in what's their visceral fat level, what's their muscle mass level, what's their body fat percentages. And I'm looking at multiple metrics rather than just a scale. But yeah, there are some risks that need to be addressed. Like any other drug, you just have to be aware. And we do
Which,
things to
like anything,
compensate.
so microdosing, monitoring really work. Actually, we'll even make a joke. We were supposed to film earlier, and I'm literally texting because Ashley's like, if you don't get your blood work done for next week, So, it's important to obviously
Yeah,
stay, and like anything can be abused. Anything can
sure.
be overused. And
Right.
I
And there's no free
will
lunch.
say that,
Like every medication
no,
has a
there isn't.
drawback.
And I will, and I want to be open with people. I don't ever want anyone to think, oh, Melissa went and did things. Like, there had been months where we went through a time where I was like, it's funny what you said about protein. I've always loved meat, but I didn't realize as I've been going on this journey how much I wanted to eat sweets, or I wanted to eat like the protein actually was tricky to eat or to not do. And you have to
For a
be,
lot of women.
it is. And I realized that there was months, and maybe the busier I get, like, oh, I wanted a piece of bread. And yeah, I kind of knew I could get away with having a couple more pieces of bread because maybe it wasn't going to land as much. Bread's not bad. I'm not saying bread's bad, but if
Right.
I also didn't have any protein that morning, I just drank a coffee and then something else. It's really, when I think of the drug, if you can use the mental aspect of it and the mindset,
Mm-hmm.
it's this really great opportunity to investigate why you eat the food you eat, why you crave the things
Yeah,
you
the
crave.
noise is quiet.
It
So
is.
there's less of that seeking. I'm just going to get a little candy and I'm just going to get a snack and maybe I'll have another, that knee jerk reaction to just say, yeah, sure, I'll eat more. That calms. And I find patients, I had a former alcoholic patient too, who had turned to food and other things just to try and fill that dopamine seeking void. And
Mm.
she called me about a week or two in, and she was like, what is this? I just sat at my desk for 4 hours. I didn't open a different screen on my computer. I didn't dig in my desk drawer. She was like, what is this voodoo? And I was like, your brain was on fire. And we just quieted that down.
Now, the longer you're on it, let's just talk about it, right?
Mm-hmm.
So let's talk about the longevity of it. You're on it a long time. If you're on it for a while, can you stay on it and microdose it for
Sure. I mean,
a
they
long
keep
period of time? I
diabetic
mean, is
patients
there
on full pharmaceutical dosing for perpetuity.
most of
I
their
mean,
life,
yeah,
right? There's no ending
right.
of it. So if it's monitored properly, you can keep on it. But one thing, and I'd love to ask you about this, is like, the longer I've been on it, it really has opened up where the human behavior component is something you have to evaluate. And I think a lot of people, not judging them, but because life is busy, we look for quick fixes and we're groomed that
Mm-hmm.
way.
Yeah,
I
it's our
don't think it's done
society.
intentionally. Yeah, it's society that when people go, oh, it's a magic drug. Well, listen, everybody in the current society is looking for some type of magic pill, magic drug, magic something. The question comes down to
So
is,
is thyroid medicine if you have a thyroid issue. I mean,
yeah,
right. It's not
are
a
you
silver
willing
bullet
to
for
do the
sure.
work? Right? Are
Right.
you willing to put in the work in anything so that you can get across this? But having that additional weight off my body has made me be able to work on other things that I needed to focus on that I couldn't even get ahead of
No,
because
and
the
it's
weight
doing
was
well, and it's doing a lot of things for you also that you probably don't even notice, right? So the fact that it has reduced your inflammation has allowed your hormonal communication, the ovarian and adrenal discussion in your body that's happening, that now has a louder voice because your body's not so distracted with trying to just constantly manage this inflammation. So it's calming the
my
brain, it's calming peripheral inflammation, it's
my
improving
cycle,
insulin sensitivity.
my
Yeah,
menstrual cycle is not as bad as
exactly.
it was.
Right. Because now you're able to focus and detox those hormones out more effectively. So it's really impressive.
It is. And again, I know we're sitting here saying all great things. Like we said, I'm not sitting here saying that there isn't people that are
Sure.
overusing it. I just watched a reality show of the girls from Baton Rouge. I don't know. They did like a intervention because she was going to 9 different drugs, getting different prescriptions from different. I didn't even know you could do a GPO,
Wow.
an Ozempic intervention. I don't know if you, there's,
Me either.
okay, like it's a reality show will show us everything. And
All
I
right.
kind of chuckled. I first chuckled and just kind of laughed. And then I was like, well, wait a minute. Okay. Anytime somebody has body imaging issues, struggling with anything, they might go to an extreme and abuse something, right? So
Sure.
it's moderation in lifestyle, in balance, in
Yes.
like all of those things, right? It's really comes back to balance. And for me, I know you and I have talked about this with people. I don't mean to go always about the mind, but I can't get away from it because I think people rely on their logical thought, their brain so much. They think whatever their mind thinks is true. But the truth is, if your gut is out of whack, your body's not, not all balanced, and you're not in the best of, your mind is going to tell you lies. Your mind's going to just tell
Sure.
you,
You're going to have
right?
cravings you never had before. You're going to believe things, it's so intertwined. And even these hormonal fluctuations, when women in perimenopause, their estrogen tanks and their progesterone tanks. And now they can't make serotonin as well. They don't activate their GABA receptor. And so they feel like the whole world is against them and they're anxious and sad. And sometimes we don't realize those things because how are you supposed to know that? You're trying to make
Yeah.
sure your kids are going to school and you're getting your job
So
done.
as we talk about that, and I wanted, them to hear that, but we then got really deep as we went into this is that you came and recognizing one thing we've been talking about with your kids, my own kids, myself, is this whole body approach, right? The balancing, the posturing,
Hmm.
how our body absorbs things. And so connectatively, do you see that patients that are trying to achieve these things, like how their bodies look, how they walk, how they function, like, the more we see how much inflammation they hold in their head, if anybody ever comes to Lafayette, Ashley has a beautiful spa in her backyard, cold plunge sauna. And I'm all about, literally one day she's away and me and my daughter in her cold plunge. She's looking at the camera. So tell me a little bit about cold plunging, sauna, exposure therapy. What is that doing to the body? We all know, I mean, me, you, your husband, like we talk about it all the time. I mean, cold therapy has changed the game for me. What
Hmm.
is that doing to the body?
Well, it's interesting because you're actually kind of tapping into it is a low dose inflammatory response where the body goes, oh no, what's happening? We need to go in and repair and see what's going on. And so you'll get this kind of endorphin release where you start to feel really great and it can even upregulate dopamine. And so I find that while it's not the most fun in the world to sit in that freezing cold water for a few minutes, your day is exponentially better. And then, I mean, we know there's so much data on sauna and most of our toxins are stored in those fat cells. And so you're trying to get these toxins out, and sweating is, I mean, we were made to do this. So we're just tapping into our natural rhythm of how the body is made to get rid of those terrible things. And yeah, there's a lot of really cool strategies about integrating hot, cold, alternating therapy and using the cold plunge. have to watch with women sometimes if they have a lot of cycle dysregulation. Sometimes they can't tolerate that degree of the water will need to be a little less cold, and maybe they're in for just a few less minutes.
That's interesting because yeah, there's a lot of people when I bring it up, they're kind of like, "Oh, cold, no way." Is
Right.
is that is that due to an actual like physiological situation, like their body's
Well,
feeling
I
it
mean,
different? Like,
you just don't want to put yourself in a state of pain, which is what
mm.
that low dose is. But yeah,
So
they're
I
actually
just like pain because I like love that.
no, it's just that you're very mentally strong and you know that these benefits will be worth it after I put in this work. And so it does also
Mm.
help to build this behavioral reinforcement that like I'm putting in this tough work and now I feel better and reaping the rewards of that. But yeah, the cold plunge, I mean, it's been game changing for us. I mean, we feel amazing after we do it. And
I
then
um
even the kids will hop in the sauna with us, which I love too.
I love that too. For listeners, Ashley's husband is Paul is fabulous, and I'm always like, he's got this like glow about him, and I go, it's probably because he's cold plunging in sauna every morning in the backyard.
Yeah.
He's
Yeah. And
just
I'll
got
hear
the
him.
two of you, big smiles. I'm like, that's what cold plunging in sauna does.
Yeah. The
How
Ramsey Wellness Center has done wonders
The
for us.
Ramsey Wellness Center. It's coming to Lafayette before we
That's
know it.
right.
It's on its
We should
way. We're
probably
so
make this a
excited.
real thing. But
We
yeah.
should absolutely make this a real thing.
Right? I'm
Um,
in.
you and me both. One thing I'd love to, as we're kind of coming here, is I'd love to get your take on the myo teeth aspect because you didn't. I mean, not like you didn't know breathing and all those things, but when we
Sure.
first met, you kind of heard what's interesting about it, what was surprising about it, and like, from the medical side of things, where do
Well,
you see like?
so again, I'm a physician assistant. I'm supposed to be noticing these things. And I was very humbled by your 2-second evaluation of why have you not cut that kid's tongue tie? Why does he not have tongue? Why is he not doing therapy? I need to help you. And I was so thankful for that. But as a parent, it's just it's okay. We're not going to notice all these things, but we do find it may be just a little opportunity and maybe you can explain how maybe parents can check their own kids on if they maybe need some intervention, because even as a functional medicine PA, I felt like I didn't know that. And
Well, the
now that
one
I see the implications, I wish I would have.
Well, because the one thing we talk about for screenings that, whether it's PAs or medical doctors, pediatricians, I wish we could, I mean, even dentists, it's, there's a base screening called the TRMR and it comes out of
Okay.
Stanford. And it's kind of 2015, I believe the study came out, and it was a reintroducing of how to evaluate tongue ties, right? And so
Hmm.
for the most part, they were always about stick the tongue out. And if you could stick your tongue out, you were fine. And the truth is, it's like, I think 90% of people can stick their tongue out. And if 98, maybe even higher, I
Well,
could be
and
wrong.
even when Henry's a baby, there was discussion on should we? I think maybe he might. I don't know. If he breastfeeds, though, just don't worry about it. You know?
Well, everything that we're talking about when we talk about the body and how it functions is it kind of goes back to like anatomy, right? And anatomy
Hmm.
101 goes, the face grows down and out, muscles win over bone. And if that tongue can't elevate without having to, right, use the mandible, that lower jaw during swallowing and development, that's why breastfeeding matters so much. But
Hmm.
as we've talked, I mean, some women will lactate really over lactate, so the baby won't have to work really hard. Some won't lactate at all. There's so many different
Sure.
aspects to it. But when that child's tongue can't function in a way that can support the anatomical craniofacial growth, what is going to have the biggest side effect is the losing of the airway space, right? Every time somebody's bite, so the less you can see someone's lower teeth and that lower jaw goes back, 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 back. So an overbite, right? You can't see.
Hmm.
That means that lower jaw went somewhere and it's pushing back into that airway space. And so therefore, if the tongue is falling back into that, you're creating obstructions. And one thing for medical, we always wish we could cross the bridge better is snoring is not normal. It's just common.
Yeah.
Sweating in your sleep, struggling to get into that deep REM, and
Yeah.
so we always would love, and we could get to a place as like getting people to do more sleep analysis. And I think now with Aura rings and things like that,
Hmm.
people are more aware. Would
There
you
is a
say,
heightened awareness. Yeah. I
I was just
love
going to
my
say, are you
patients are
seeing more of that?
incredible. Yeah. I have the best I just have amazing patients because they all want to. They're interested. They're seeking data and they're trying to learn about themselves. And in this era of wearables and Whoop bands and Aura rings, and it's actually really wonderful because patients are coming to me like, "Hey, I think something's wrong. Look at my sleep data." Or, "Hey, something's wrong. Look at my heart rate variability." And I'm like, "This is amazing. This is stuff that we suspected in the past but had no proof of." And so, yeah, it's been really helpful on my end, both in awareness and in treatment, because now I can say, "Hey, look, this is what happens, and this is why you need to go do therapy, and this is why you need to go look at an appliance, and this is why I need you to do a couple $100 sleep study." And patients are more like, "Okay," rather than before, like, "I don't have that," you know? So it's been really helpful in awareness in my patient population and for me.
So, right, in the perfect world, if we had a magic wand, and there's a couple little beta test practices going off in Denver and LA. But,
Ooh,
the goal is that I've been pushing
go
it.
on.
I think
I'm
actually
like,
is that medical dental, so like a wellness center, but it comes where there's patient comes in,
mhm.
presents with whatever their issues are. It's a sleep study, it's blood work, it's an oral evaluation, it's a full functional body evaluation, and then it's somebody like you, myself, Dr. Bond gets together. We sit down and go, what is a complex treatment plan for this person so that
Yeah,
we can then present all aspects, children, things, but it starts with understanding how they're functioning. And I
yeah,
think we are getting in the next 5 years. I mean, now we just came up, there's something called, we talked about this, called the Somnu headband, which is sound radiation band that goes around your head that actually will use sound waves to clear the sinuses. And the research is showing that it works as well, if not better, than over the counter Claritin, which we know will dry out and cause issues.
and in
They just
long-term use cause cognitive decline. I think a lot of people don't realize that long-term use of antihistamines is correlated with cognitive decline later in life. So you think you're just treating your sinuses for years, and you've got
well,
issues when you're
the other big thing that okay, so that's huge. So, right. So
yeah,
you're telling me you're treating your sinuses, you have long-term cognitive issues. The other thing is, what is the data of having poor oxygen to the frontal lobe? We know there's a correlation with dementia, with
sure,
blood pressure issues, heart disease, all of these aspects. Getting the
all tied to
body.
inflammatory dysregulation, or overreaction.
So it's really, yeah, it's a really powerful time to see that the more we have conversations, the more we're looking at people's whole bodies and their approach from a younger age, we're going to get healthier people in this realm. And I think that's my thing. I just have realized I can't treat adults or kids without them seeing somebody like you, or seeing an
Mhm.
orthodontist that's willing to do expansion, or doing these
Yeah.
things. And, the goal is to continue to have these conversations so that patients can advocate for themselves more,
Yeah, and it
right?
becomes more acceptable and mainstream, and it's not such a, "Oh, that's weird," because as someone in the functional medicine space for 16 years, I was the like voodoo crazy person in town. Like, "Why are you giving them hormones? What's wrong with you? Why do you do that?" And now, OBGYNs are incorporating pellets in their practice. I'm like, "I've been doing it, guys." So I
You,
am glad that the needle is moving back towards reintegration and believing the patient and looking at all aspects that contribute to their longevity and health and quality of life.
I think, we have a lot, social media and Instagram and YouTube and podcasts. They've changed things. And, I
Hmm.
think for you and me, I talk a lot about why I ended up down here. And I think it was ultimately for me to recognize that most of America is made up of smaller cities like this, and of people that need access to good functional care. And I'm so grateful to be able to create that and bring that. And I think more conversations like this to make it less taboo and to connect these three major pillars, which are the body, the mind, and how it all functions and structurally. It's important to continue to get to those root cause. So I'm could not be more grateful, to be able to talk to you and first of all know you and get to work with you. If you had your perfect ideal practice, like of everything you would do, what would that look like for a patient? Like, what would
Ooh,
that be?
a girl can dream.
Yeah, you can dream
Um,
here.
right? From a from a testing standpoint, I mean, obviously I would have them do a sleep study. I also feel like, well, we can get into this in a second, I guess, but I feel like women never test quite as severely as men. And so maybe having some discussions about that. But I would evaluate their sleep. Are they oxygenating? How many issues are they like hypopneas are they having a night or full on apneas? I would have a lot of patients obviously do blood work because I look at from a functional standpoint, I'm not just checking like a basic TSH for their thyroid function. I'm looking, do they have antibodies? What's their conversion to the active hormone? So I would do a lot of full blood work for the things that I couldn't get out of saliva or urine. I'm a big fan of the Dutch test. I've done them for a few
What's
years.
that? What's the
So
Dutch
Dutch
test?
test is made by a really cool company called Precision Analytical, and it stands for Dried Urine Testing Comprehensive Hormones, which is a mouthful, so they go with Dutch. But it's easy because patients can do it at home, and it's a dried urine sample at specific points throughout the day. And so I can get their total cortisol production. I can get their cortisol curve, both free and bound, cortisol and cortisone. I can get all of their hormone levels, reproductive hormones. I can get what those hormones metabolize into. And then I get a little insight into, is there any gut inflammation or neural inflammation? What do their dopamine metabolites look like? So I get kind of this whole snapshot on the patient. And yeah, they're a little bit more entailed than just a blood draw, but I can use both of those things together to really evaluate what's happening in the patient. And then if we're really shooting for the stars, I would probably do a micronutrient test and see what nutrition looks like inside the cell. So,
Oh, yeah, we need to get that. I
and
need
a
to find
GI
out what
map.
nutrition
I would
and a
also do a
GI map.
GI map.
Okay.
Yeah.
And what does the
So,
GI map give us?
so the GI map, never in my life did I think that I would be talking about bowel health as much as I do. But you'll have patients who put in all this effort and they're like, okay, I've changed my diet, but I'm still bloated. And I do this, but I still feel like I have these cravings and I still feel like I'm on fire. And so actually taking a look at their microbiome, like what's growing in there? Do they have enough of the good bacteria that fight for our team? Do they have
Mm.
an overgrowth of bacteria or yeast, or God forbid we find a parasite in there? You just get an idea of why they maybe can't make those neurotransmitters or why they continue to feel anxious despite all this other action that they've done and why they can't break their estrogen down properly. And so you get a good glimpse of every aspect of their function, and then you can tie it all together and come up with a better plan of maybe what would be more effective, because you can get supplemented to death. It gets overwhelming really quickly. And so you can prioritize, hey, we need to get this gut dysbiosis under control. Then we'll move on. Or your adrenals are completely out of whack and over the top. Maybe we need some calmers first, or, whatever. It just helps me kind of target the therapy because, again, I can put a menopausal woman on hormones all day, but if her gut's dysregulated and her cortisol's through the roof and she's not doing anything to improve her sleep quality, she's going to feel better, but she'll never be like, oh, I feel great.
She'll
So,
never get to that top of that mountain, right? She'll
right,
never
you'll
100% get
always
there.
just be missing something.
You'll always feel
So,
a little bit, which, that stinks for people to not feel
yeah,
like they can achieve those goals. And, having sleep issues and these hormonal balance issues and just feeling like you are trapped in your own monkey suit and your mind's going all over the place, that's torture for a lot of people.
yeah.
It's
And
really an
especially if
issue.
you go to a provider who's like, oh, it's not a big
Oh,
deal,
I know.
So feeling
It's super
heard and
frustrating.
investigating that.
But it's super frustrating. And I want to stay PR, I want to say politically correct, but I don't know. I feel like the more I keep doing this and the more I keep talking to, it does come to a point like I love that we live in a world that if gosh forbid you get into a car accident, something major happens, we have top notch, amazing surgeons that can
Oh,
fix and do Western.
for
No,
sure.
not knocking that, but we
No,
have
neither.
with the evolution and the growth of quick, of that type of care, like just fix it. Nobody has to fix themselves. Nobody has to do it. We have lost a fundamental issue of having to take control and be accountable for figuring out the body, right? Like as
Yeah.
providers, it is our job to spend more time with patients.
And to reintegrate. Because I feel like in our current system, it's will you see somebody for your gut and someone for your brain and someone for your nose. And sometimes just taking a step back and saying, hold on a second. How do all of these things influence one another? And is there some central catalyst that I can work on or that I can identify and improve? So we need the specialists, of course.
We
We have
do, but we
but
don't
we're
we
missing the
need to
foundation.
yeah, we need to open our eyes, pick our heads up. In
Hmm.
dental, I make a little joke. You don't know, like, the surgeons do, but they wear loops, they all like, and I
Yeah.
said, we've all been on our loops a little too long and we're so hyper focused on
Yes.
one aspect. And because of that, we have lost full collaboration cares. I actually do think the Airway community and what we've done in the last 10 years, if you go and you start, your algorithms, everybody else's algorithm, every conference we've done, collaboration cures, you're only as good as your team. You need to get it. Like you need to talk to the doctors. And it's not a joke. I came here, I'm strong minded. I have these big opinions. I come out of it and it was a lot for people to digest it. And people were nice and kind, but I think deep down they were like, wow, she just, a lot of conviction, a lot of feelings. But I am starting to recognize that it takes people to make other people a little uncomfortable so that they can, maybe not that they have to jump in and work with you or me, but take a moment to say, I wonder if I am practicing just one dimensional or I'm not
Hmm.
really looking, or look at maybe your own schedule and say, wow, I keep seeing the same thing over and over again. These people aren't getting better.
Hmm.
I think that's my, and I think I didn't even really know how much Dr. Bond put himself out there. Like I didn't
Yeah.
until recently, and doing more research is getting ready for today. I know you very well, but I don't know him. I know of him, but I really
Yeah.
started researching. He really put himself out here way early. People had a lot of opinions about what you guys were doing.
Sure.
Um, you guys were
Yeah.
kind of the first ones making people uncomfortable, questioning the status quo.
I mean, I would give him that title for sure.
Yeah, and, everybody, you can have
He's
your opinion
big
on
in
it.
the no, for sure, but he's been in big in the regenerative space, which is actually how I had met Dr. Tina Moore back in the day
Okay.
because she was involved in that regenerative prolotherapy and kind of
And is
scene.
Dr. Moore here?
No,
No, no.
she was out of Oregon, but I think she actually just moved to Arizona.
Oh, duh. Oh, yes, yes, yes. I remember you and
Yeah.
I had talked about her podcast. Okay, so you really took a
Hmm.
lot of her you were working close with her?
She really sparked my interest and openness, I should say, and willingness to research these GLP-1s. So
Okay.
that was really wonderful. But they have been, along with a lot of other doctors, Dr. Brown used to be the president of it, but the big society that integrates these regenerative injection practices into healing. And when I started working for him, I said the same thing. I thought I was going to be an orthopedic surgery PA. And I start working with this sports med guy, and he's like, I'm going to inject this sugar water lidocaine stuff. And I'm like, what? And patients just kept getting better. And I was like, okay, let me look into this. So yeah, he is the only provider around that does autologous stem cells, so drawn out of bone marrow and re-injected into various joints and using that regenerative approach for healing. And our practice kind of evolved because when I started, I'm just trying to help. I don't know what I'm doing, right? And he has all these patients, and the ones that I would say, oh, well, their thyroid's a little off and they have a B12 deficiency and their vitamin D is really crummy. And I would optimize these patients. Their regenerative outcomes were exponentially better. And so then we were like, wait, and then our schedules kind of evolved and I would tee them up prior to their regenerative practices.
Mm.
So yeah, it's been a really cool model for
It
us.
all, well, it's been a great model. Well, I always tell people you're not broken. You're just out of balance.
That's it.
Right? No one's broken.
That's actually
And
what I named
that,
my women's hormone program is balance.
balance is
Yeah.
everything, right? Balance
Yeah.
is key. It's about living in balance, not
Yeah.
perfection. It's not about
No.
being perfect. It doesn't exist. It's
And if
not
you think
real.
you are, that's a giant problem.
And
So
since knowing you, working with you, getting to know your family, you've just been such a beautiful addition to, just kind of confirming that. And I'm so grateful that I get to collaborate with you, not only on a personal side, but even professionally. And to drop a little bit for some of the listeners, I've been kind of putting some nuggets into Ashley's ears that we'd love for her to maybe put together a little course for some of us myo people and dental people. So ultimately, what I care about is communication. And I think what you guys are doing goes so nice into everything. So I would love, we're going to keep working on that stuff. We'll drop that stuff, but I could talk to you for hours. Obviously I do. Every time your poor kids come into the office, they're like, okay, what are we doing? They like have knapsack, they have their beanbag chairs and laying on them. But what's going to happen is we're going to get a bunch of people that are going to want to know, how do they consult with you? Do you see patients do you see patients out of state? Can we get them to Zoom with you? Do you Zoom consults online? Tell us how we can find you. How can we send people your way?
yes, I'm currently practicing at Bond Medical Center in Lafayette, Louisiana. I do some telemed. I will try to get better on my social media and sharing some education pieces. I feel like that's a place I could improve upon. But yeah, I would absolutely love to help. And we can attach maybe at the bottom of this our address and contact phone number
Yeah,
and
yeah. We're
get in
going to put
touch with my
everything in
staff.
the show notes. Yeah, we'll put everything in the show notes, how to get in contact with you. And we will keep everybody abreast. We're going to keep getting more content. You're going to see Ashley on the podcast again. It's too easy to talk to her. I cannot thank you enough. Last
Thank you
thing,
so much.
this is how we wrap it. What does mind your mouth mean to you?
Ooh, I should have seen this one coming. I'm unprepared.
Well, that's the
Um,
goal of it. We don't let any of the guests know that we're bringing it up so that it just feels, what's the first thing that comes to mind when you think of it?
okay, so first thing that comes to me is speaking gratitude and speaking into existence the things that you want in your life, the focusing on the positive. And then obviously I'm so focused on nutrition that minding the beautiful chemical-free things you put into your mouth would be important for me.
Well, that is a perfect way to wrap this episode up. Thank you, everybody. Stay tuned. We can't wait to see you next time.